What I'm about to share with you could completely change the way you look at the blood pressure medication sitting in your medicine cabinet. If you're taking amlodipine, losartan, or lisinopril, there's a real possibility that a symptom you've been dismissing as aging, stress, poor sleep, or simply having a bad day may actually be your body trying to tell you that your medication is affecting you in ways no one fully explained. And that's the part that concerns me. People usually don't get hurt by these medications because they were prescribed incorrectly. They get hurt because they don't fully understand what these medications are doing inside their bodies. They miss the warning signs until something serious happens. Before we begin, make sure to subscribe to the channel so you never miss important health information designed to help protect you and your loved ones. I'm Dr. Richard Ben, and if you've been prescribed amlodipine, losartan, or lisinopril to control your blood pressure, there are 11 important things you need to understand right now. Not because your doctor is hiding anything from you, but because appointments are often short, explanations are rushed, and many patients leave with a prescription in their hand, but only half the information they truly need. By the end of this video, you'll understand which side effects are common, which ones are potentially dangerous, which symptoms seem harmless but aren't, and why the most important truth has very little to do with the number on your blood pressure monitor and everything to do with whether you can safely stay on your medication for the long term. Let me start with Gloria because her story perfectly illustrates why this conversation matters. Gloria was 72 years old. She was organized, disciplined, and the kind of patient every doctor hopes to have. She took her medications exactly as prescribed, attended every follow-up appointment, and never missed a dose. On paper, everything looked perfect. Her blood pressure improved beautifully. But 3 months later, Gloria came into my office with a concern. Her shoes no longer fit properly. Every evening, her ankles became swollen and puffy. By bedtime, she felt unusually heavy and uncomfortable. She assumed she was gaining weight. Her daughter worried there might be a heart problem. Gloria herself was frightened. What no one had fully explained to her was that the same medication helping her blood pressure was also causing a specific side effect that often makes people think something else is wrong. And that brings us to number 11. One of the most important things doctors often don't have time to explain is that these medications are not interchangeable pills with different labels. Amlodipine is a calcium channel blocker. Losartan is an ARB, or angiotensin receptor blocker. Lisinopril is an ACE inhibitor. Yes, all three medications lower blood pressure, but they do so through completely different mechanisms. And because they work differently, they create different patterns of side effects. Understanding that distinction is critical. Amlodipine commonly causes swelling in the lower legs because it relaxes blood vessels in a specific way. Lisinopril is well known for causing a persistent dry cough. Losartan is often prescribed for patients who cannot tolerate that cough. Same goal, different pathway, different side effects. And here's why that matters. If you develop a cough while taking lisinopril and assume every blood pressure medication will cause the same problem, you may stop treatment entirely when another medication could work perfectly well for you. If your ankles swell while taking amlodipine and you immediately assume your heart is failing, you may experience unnecessary fear. And if you feel perfectly fine while taking losartan and assume there's nothing to monitor, you could overlook important issues such as elevated potassium levels developing quietly in the background. The hidden truth is simple. The name on the bottle tells you the class of medication. The class tells you the pattern of side effects. Once you understand the pattern, you stop being surprised by what your body is telling you. And when you stop being surprised, you make better decisions and seek help sooner when something doesn't seem right. That understanding alone can prevent a medication side effect from becoming a medical emergency. This is the exact issue Gloria was experiencing. Ankle and leg swelling is one of the most misunderstood side effects associated with blood pressure medication. Many people assume they're eating too much salt. Others think they're retaining water because of kidney problems. Some believe they're simply becoming less active and gaining weight. But with amlodipine, the swelling often occurs for a very different reason. The medication relaxes small arteries more than veins. As a result, blood flows into the legs more easily than it flows back out. Pressure builds up in tiny blood vessels, causing fluid to leak into the surrounding tissues of the feet and ankles. That's why so many people say, "I'm fine in the morning, but by evening my socks leave marks on my legs." Let me tell you about Arthur. Arthur was 76 years old, and every afternoon his ankles looked noticeably larger than they had that morning. He assumed it was simply part of getting older. Eventually, he began sleeping with his legs elevated, and noticed that the swelling improved overnight, only to return again later in the day. What he never realized was that the swelling started shortly after beginning amlodipine 6 weeks earlier. The real danger wasn't the swelling itself. The danger was that Arthur never talked about it. He didn't want to bother his doctor. He continued taking the medication while becoming increasingly uncomfortable. Eventually, he started skipping doses on days when he planned to go out because he felt embarrassed by how his legs looked. And that's how a manageable side effect can turn into uncontrolled blood pressure. The swelling doesn't necessarily mean the medication is wrong for you forever, but it absolutely means the conversation needs to happen. If you notice persistent ankle or leg swelling while taking amlodipine, don't ignore it. Don't assume it's just age, and don't quietly stop taking your medication. Talk to your healthcare provider. Sometimes a dosage adjustment, medication change, or additional evaluation can solve the problem before it affects your health or quality of life. This is one of the most commonly overlooked side effects of lisinopril. Many patients are told that a cough is possible, but what often isn't emphasized enough is that the cough doesn't always appear immediately. Sometimes it develops within a few days. Sometimes it takes a few weeks, and in some cases, it doesn't appear for months. That's why so many people fail to connect the symptom to the medication. Instead, they blame seasonal allergies, dust in the home, acid reflux, lingering colds, or dry air. The cough itself is usually dry, irritating, and stubborn. It's not typically productive, meaning it doesn't bring up mucus. It often feels like a constant tickle in the throat that simply refuses to go away. And because it frequently worsens at night, many people assume the problem is related to their lungs rather than the medication they've been taking every day. Helen learned this lesson the hard way. At 69 years old, she had been taking lisinopril for 4 months when she developed a persistent tickle in her throat. Soon after came the nighttime coughing fits. Her sleep deteriorated. Her energy levels dropped. She woke up feeling exhausted every morning and assumed it was simply part of getting older. She tried throat lozenges. She changed household products. She even replaced the air filter in her home. Nothing helped. When I asked her when the cough first began in relation to starting the medication, she was shocked. No one had ever explained that a lisinopril-related cough could appear months after treatment begins. Once she understood the connection, everything suddenly made sense. The reason this matters is that many patients silently endure this cough for months before eventually stopping the medication on their own. And that's exactly what we want to avoid. However, there's something even more important you need to understand. A dry cough caused by lisinopril is usually not a medical emergency. But swelling of the lips, tongue, face, or throat is a completely different situation. If you ever experience swelling that affects breathing or swallowing, seek emergency medical attention immediately. Do not wait. Do not assume it will improve on its own. ACE inhibitors such as lisinopril can rarely cause a serious reaction known as angioedema, which can become life-threatening very quickly. Although ARBs like Losartan can also rarely cause similar swelling, the classic concern is with ACE inhibitors. So remember, a cough is usually bothersome. Swelling of the tongue or throat is an emergency. Knowing the difference can save your life. This may be one of the most dangerous truths in this entire discussion, because it often hides in plain sight. If you're taking Losartan or lisinopril, potassium matters. Most people hear that and immediately think, that's fine, I don't take potassium supplements. But potassium doesn't only come from supplement bottles. It's found in salt substitutes, electrolyte drinks, heart-healthy seasoning blends, meal replacement products, and many over-the-counter items people use every day without thinking twice. Both Losartan and lisinopril can increase potassium levels in the blood. And while potassium is essential for health, levels that become too high can interfere with the electrical activity of the heart. The danger is that elevated potassium doesn't always announce itself loudly. Sometimes symptoms include muscle weakness, fatigue, tingling sensations, muscle cramps, heart palpitations, irregular heartbeats. And in some cases, there may be no noticeable symptoms at all. Consider Robert's story. Robert was 74 and committed to improving his health. He reduced his sodium intake, carefully read nutrition labels, and proudly switched to a salt substitute because he believed he was making a heart-healthy choice. What he didn't realize was that many salt substitutes replace sodium with potassium. As a result, he was taking Losartan, which can increase potassium levels, while simultaneously adding extra potassium to nearly every meal. Over time, he began feeling weak. He noticed occasional skipped heartbeats. Something felt off, but he couldn't identify the cause. When blood tests were finally performed, his potassium level had risen high enough to require immediate medical attention. The tragedy is that Robert wasn't careless. He was trying to do everything right. He simply didn't know how the pieces fit together. That's why education matters. Patients often assume danger comes only from prescription bottles. In reality, it can also come from products purchased at the grocery store. This topic confuses many people and sometimes causes them to stop medication that may actually be helping them. Losartan and lisinopril are not simply blood pressure medications. For the right patient, they can also provide long-term protection for both the kidneys and the heart. However, when treatment begins, or when a dose is increased, blood tests may occasionally show small changes in kidney function. A person's creatinine level may rise slightly. Their estimated kidney filtration rate, or eGFR, may decrease slightly. When patients see those numbers, they often panic. They assume the medication must be damaging their kidneys, and in some situations, that can happen, but not always. Sometimes a small, carefully monitored change is expected because these medications alter pressure within the kidney's filtering system. That's why monitoring matters. The numbers must be interpreted in context. Sharon nearly made a serious mistake because she didn't understand this. At 71 years old, she had high blood pressure and early kidney disease. Her doctor prescribed lisinopril specifically because it could help protect her kidneys over time. A few weeks later, she reviewed her laboratory results online before speaking with anyone from the medical office. She noticed that some numbers had changed. Immediately, she assumed the medication was harming her kidneys. She was moments away from stopping it completely. When we discussed the results, I explained that the important question wasn't simply whether the numbers had moved. The important questions were, how much did they move? What was the overall trend? And what else was happening in her body? A mild, expected change under medical supervision is very different from a dangerous decline in kidney function. That's why follow-up blood tests are not optional. They are part of the treatment itself. These medications can be powerful tools, but like any powerful tool, they must be monitored intelligently. And that brings us directly to one of the most overlooked risks facing older adults today. This is one of the most overlooked dangers, especially among older adults. If you're taking Losartan or lisinopril and then develop vomiting, diarrhea, a stomach virus, poor appetite, or excessive sweating during hot weather, the medication that was helping you yesterday may affect you very differently today. Your blood pressure can suddenly drop too low. Your kidneys can become stressed. You may begin feeling dizzy, weak, lightheaded, or even faint. In some situations, acute kidney injury can develop much faster than people realize. The medication itself hasn't suddenly become dangerous. What changed is your body's fluid balance. When dehydration occurs, the same dose of medication is now working inside a completely different environment. And that's where problems can begin. This is one of the most common, nobody told me that moments in blood pressure treatment. Many people continue taking their medications exactly as prescribed while experiencing illnesses that dramatically affect hydration. Frank discovered this the hard way. At 78 years old, he developed a severe stomach virus. He couldn't keep much food or fluid down, yet he continued taking his usual Losartan every morning because he was proud of never missing a dose. That evening, he stood up from the couch and felt the entire room spin around him. He nearly collapsed. When he arrived at the emergency department, the issue wasn't that Losartan was a bad medication. The problem was that his body had become severely depleted of fluids. His blood pressure had fallen too low, and his kidneys were under significant strain. What Frank needed wasn't blind loyalty to the pill bottle. He needed a plan for sick days. He needed to understand that illness changes the rules. Sometimes the safest thing a patient can do is contact their healthcare provider for guidance, rather than assuming the usual routine should continue no matter what. This kind of practical advice may not sound dramatic, but it prevents countless emergencies. Medication should never be separated from the condition of the body taking it. Now let's talk about something sitting in millions of homes right now: ibuprofen, naproxen, and other anti-inflammatory pain relievers people commonly take for arthritis, back pain, knee pain, or weekend aches and pains. At first glance, these medications don't seem connected to blood pressure treatment at all. But appearances can be deceiving. If you're taking Losartan or lisinopril, especially if you're also taking a diuretic, often called a water pill, regular use of certain anti-inflammatory medications can create a dangerous situation for the kidneys. Doctors sometimes refer to this as a perfect storm. Individually, each medication may be appropriate: a blood pressure medicine, a pain reliever, a diuretic. Nothing sounds alarming on its own. But when combined, especially during periods of dehydration, these medications can reduce blood flow to the kidneys and significantly increase the risk of kidney injury. What makes this problem even more common is that many people don't tell their doctors about the over-the-counter medications they're taking. They don't think of them as real medications. They're simply something picked up from the pharmacy shelf. Carol made that exact mistake. At 73 years old, she was taking lisinopril for blood pressure control and a water pill for swelling. Several times a week, she also used ibuprofen to manage arthritis pain in her hands. She believed she was managing her health responsibly. Then her laboratory tests began showing worsening kidney function. Her blood pressure became less stable. Everyone started searching for an explanation. The answer wasn't mysterious at all. It was the interaction between the medications. Once the anti-inflammatory medication was addressed, safer alternatives were discussed, and monitoring was improved. Her situation stabilized. This highlights an important truth. Many people believe medication dangers come from rare side effects hidden in tiny print. In reality, some of the greatest risks come from common medication combinations that are never reviewed carefully enough. If you're taking Losartan or Lisinopril, over-the-counter pain relievers are not a casual topic. They're an important safety conversation worth having with your healthcare provider. Dizziness. Lightheadedness. That sudden feeling that the room shifts when you stand up too quickly? Many people dismiss these experiences. They laugh them off. They say, "I just stood up too fast." Sometimes that's true, but sometimes it's a warning sign that shouldn't be ignored. When starting amlodipine, Losartan, or lisinopril, or when increasing the dosage, your body often needs time to adjust to lower blood pressure levels. During that adjustment period, dizziness can occur. This is particularly common when moving from a lying or seated position to standing. For younger individuals, a few seconds of dizziness may be little more than an annoyance. For older adults, those same few seconds can result in a serious fall, a fractured wrist, a head injury, a broken hip, or a life-changing hospitalization. What many people don't realize is that dizziness can sometimes indicate the medication is lowering blood pressure more aggressively than the body can comfortably tolerate at that moment. Hydration status, medication combinations, illness, and individual sensitivity all play a role. Joseph's experience illustrates this perfectly. At 80 years old, Joseph lived independently and took pride in caring for himself. He disliked asking for help. 2 days after his amlodipine dosage was increased, he got out of bed during the night to use the bathroom. As he stood up, the room suddenly tilted. He grabbed the sink just in time. Fortunately, he didn't fall, but it frightened him. When I asked whether anyone had advised him to sit on the edge of the bed before standing, rise slowly, and watch for persistent weakness or near fainting episodes, he said no. He had been told the medication would lower his blood pressure. What he had not been told was what that experience might actually feel like in everyday life. That's the difference between prescribing a medication and preparing a patient. Mild dizziness may improve as the body adjusts. Repeated dizziness should not be ignored, and fainting is never something to brush aside. The goal isn't simply lower blood pressure. The goal is lower blood pressure while maintaining safety, independence, and quality of life. And that brings us to the final section, where we'll discuss the most important lessons of all. This is where many intelligent people unintentionally sabotage their own treatment. They take one blood pressure reading, see a high number, and immediately assume the medication isn't working. Or they see a low reading and decide the medication is too strong. But that's not how blood pressure works. Blood pressure naturally fluctuates throughout the day. It changes with sleep, stress, pain, physical activity, meals, caffeine, posture, and even anxiety about the measurement itself. One reading is not a verdict, it's a snapshot. What truly matters is the overall pattern. What matters is consistency over time. What matters is how your body responds day after day, not what happened during one stressful moment on a random Tuesday morning. Amlodipine, Losartan, and lisinopril should be evaluated based on trends, not isolated numbers. Diane learned this lesson firsthand. At 67 years old, she checked her blood pressure every time she felt worried. If she had a headache, she checked it. If she felt stressed, she checked it. If she saw a concerning news headline, she checked it. And whenever she received a high reading, she immediately checked again. Then again. Then again. Before long, she had pages filled with numbers and a mind filled with fear. She became convinced her lisinopril wasn't working. But when we slowed the process down, had her measure at the same times each day, and encouraged her to sit quietly before taking readings, an entirely different picture emerged. Her medication was actually working quite well. The problem wasn't the medicine. The problem was the method. This matters because once people convince themselves a medication has failed, they often begin making impulsive decisions. They skip doses. They take extra doses. They request unnecessary medication changes. Good medication combined with poor interpretation often creates poor outcomes. The key is to focus on patterns, not panic. I cannot overstate how often medication timing creates unnecessary problems. Blood pressure medications work best when taken consistently. The same general time, the same routine, the same daily habit. When a dose is missed, many people panic. They worry their blood pressure will suddenly become dangerous. As a result, they double up later. But unless your healthcare provider has specifically instructed you otherwise, doubling a dose is usually not the correct response. Most medication instructions recommend taking the missed dose when you remember it, unless it's already close to the next scheduled dose. If it's close to the next dose, you simply skip the missed one and continue with your normal schedule. You do not take 2 doses at once. Yet many people do exactly that. They're trying to help themselves, but instead they create unnecessary dizziness, weakness, and blood pressure fluctuations. Consistency may sound boring, but consistency is what transforms a prescription into a stable treatment plan. Martin's story demonstrates why this matters. At 75 years old, he considered himself a responsible patient. Most days, he took his medication exactly as prescribed. But when he forgot a morning dose, he would take it at lunch. If he later worried about his blood pressure, he might take another tablet just to be safe. One evening, after seeing a high reading at home, he decided to take an extra dose because he feared having a stroke overnight. The next day, he felt exhausted, weak, and unsteady. The problem wasn't recklessness. The problem was misunderstanding. Blood pressure medications are not emergency rescue pills. They are long-term management tools. Their effectiveness comes from steady use, not emotional reactions to occasional readings. If you're unsure what to do after missing a dose, ask your healthcare provider. If you're unsure whether you can change timing or combine doses, ask. Guessing may feel harmless in the moment, but it can create significant problems later. This is perhaps the most important truth doctors don't always have time to fully explain. The best blood pressure medication isn't necessarily the one that produces the most impressive numbers for a few weeks. The best medication is the one you can take safely, consistently, and comfortably over the long term. A medication must fit your body, your symptoms, your medical conditions, your laboratory results, and your lifestyle. That's the reality many people miss. A medication can appear successful on paper while failing in real life. Perhaps the numbers look perfect, but the side effects make you miserable. Perhaps you're struggling with symptoms you don't understand. Perhaps you've quietly begun avoiding the medication because you dread taking it. Those situations matter. Amlodipine may work wonderfully for one person, while causing significant swelling for another. Lisinopril may control blood pressure beautifully, while creating a persistent cough that disrupts sleep. Losartan may be an excellent alternative, but it still requires attention to potassium levels, kidney function, and hydration. Teresa's experience brings all of these lessons together. At 70 years old, her blood pressure readings were excellent while taking lisinopril. Any doctor reviewing her chart would have been pleased. But every night she was coughing. She wasn't sleeping well. She dreaded taking her medication. And she never told anyone. Why? Because she assumed the response would be, "You need the medication, so you'll just have to live with it." That's where many patients begin to disappear from treatment. First, they resent the medication. Then, they begin skipping doses. Eventually, they stop taking it entirely. Then, their blood pressure rises again, and everyone wonders what happened. Teresa didn't need a lecture. She needed a treatment plan that matched her reality. Once her cough was recognized as a likely medication-related side effect, her healthcare team was able to reassess the situation and consider alternatives. That's what good medical care looks like. Not silent suffering, not forcing a patient to endure unnecessary symptoms, and not focusing solely on numbers. Good care treats the person, not just the blood pressure. If there's one message I want you to remember, it's this. Side effects are not personal weaknesses. They're information. Swelling is information. A cough is information. Dizziness is information. Fatigue, weakness, muscle cramps, changes after dehydration, palpitations, or unexplained symptoms. These are all pieces of valuable data. Your job is not to diagnose yourself. Your job is to pay attention. Notice patterns, ask questions, speak up early. Too many people believe being a good patient means never complaining. That's not true. A good patient pays attention to their body. A good patient communicates concerns. A good patient doesn't wait until a problem becomes an emergency. Silence isn't strength. In healthcare, silence can become risk. So here's the practical framework I want you to remember. If you take amlodipine, watch for ankle swelling, headaches, flushing, dizziness, and heavy feeling legs. If you take lisinopril, watch for a persistent dry cough, dizziness, and any swelling involving the lips, tongue, face, or throat. If you take losartan, watch for dizziness, weakness, dehydration-related symptoms, and possible signs of elevated potassium, including muscle weakness, cramping, tingling sensations, or irregular heartbeats. With Losartan and Lisinopril, blood tests are important. With all three medications, consistency is important, and with every medication, unexplained symptoms deserve attention. Remember, not every side effect is dangerous. Some improve as your body adjusts, but not every symptom should be tolerated indefinitely either. The goal is not panic. The goal is understanding. The more you understand how your medication works, the safer and more confident you'll become. When you understand the reasons behind the symptoms, fear begins to fade. You stop assuming every symptom means disaster, and you stop ignoring symptoms that truly matter. That's where safety lives, not in fear, not in denial, but in knowledge. If you found this information helpful, share it with someone who takes blood pressure medication. There's a good chance they need this information too. And as always, I'll be here in the next video to help you understand the health truths that matter most, before they become the emergencies no one saw coming.